I think that when I look at the new evidence, for me, one of the most exciting pieces is coming from Sweden. Dr. Aragi from the Karolinska Institute and the team around the Karolinska Institute recently released the latest update on snus based on 9 major cohort studies involving 400,000 people covering 9 million person years. Now, those numbers are huge. They're huge compared to almost any other intervention that we take action on at a world level. We didn't do studies of that size in vaccines before the COVID vaccines were released. We haven't done studies on that to decide whether to use statins or to use a wide variety of drugs in common use. Yet their study showed there was no association between snus use and oral cancer and simply strengthened the case that's been made by Lars and others for decades, and we're not acting upon it at the global level. I would hope that we'd start seeing that, who I've never met, Dr. Aragi and his or her team, really need to be seen as the Richard Peter and Dahl team of the snus and oral cancer world, and given the same accolades and broadcast in every single country so that we know we have got solutions. They're simply not being picked up. And I think we also want them to publish as soon as possible data, I'm sure they have, showing what happened to snus users during the COVID pandemic here in Sweden. I have no doubt that they would have shown a substantially lower risk of complications and death compared to never smokers. And this data from this country could be the most powerful way of demonstrating that once and for all.